Welcome back, everybody. The deadline is fast approaching for Healthcare.gov's open enrollment period. If you still need to sign up for health insurance coverage this year, you only have until January 15th. That's only 4 days away, people. Today, Michael Bertaut, a healthcare economist and Straight Talk blog author, is here to tell us about how you can sign up and what changes you need to know about before you do so. Welcome back to the show, Mike.
Thanks so much. A joy to be with you.
Come on.
Yes,
We're talking
sir.
about healthcare coverage. Look, we all need to have it. And first, I want to ask you this. For people who maybe have not signed up for healthcare coverage yet, how can people sign up for it?
Well, the open enrollment period is still going on, as you mentioned. And what you would do is go to Healthcare.gov, the federal website, and if you start there and you build an account, you'll be able to see that you have access to lots of federal money to help you buy health insurance. It's amazing how many different income levels now where people still qualify to draw down assistance. And we want to make sure that you get the maximum amount of help you can get.
So true. And you know, this is for people who maybe their job doesn't cover them with healthcare insurance. I love to know that this is something for all people and they all have access to it. But there's also this thing called a special enrollment period that I did not know about. Luckily, you're here to inform us today. What is a special enrollment period and who qualifies for that?
Absolutely. Well, the open enrollment, where anybody can enroll, will end on the 15th. After that, you may have life events, like if you get married, or if you have a baby, or if you move to another state where your coverage is being reset, or if you discover that the plan that you have from your employer is not affordable for your dependents or your spouses. And we could talk about that in more detail. These things can trigger an open enrollment for you on Healthcare.gov on any day of the year.
That is good to know for sure. And everybody remember, if you sign up for coverage before January 15th, again, 4 days away, your coverage will start February 1st. But there also have been some changes when it comes to health care. First of all, I love that more people have the opportunity to get health care because there have been some finance changes, right?
Right. We've seen some new paths to coverage that weren't there in the past that could be very impactful for people who work and live in Louisiana. The fix for the family glitch allows people who get coverage through an employee in the family, a dependent or a spouse, to take that offer from that employer, which many times is not really affordable for them, and bring it to Healthcare.gov on the website and test it.
Wow.
And if they give them a determination of unaffordability, they can immediately go shop. It'll trigger a 60-day open enrollment window where they can shop on Healthcare.gov and draw down whatever tax credits they're entitled to. This is something they would have been blocked from doing in the past, is now a wide open path to new coverage.
It's great to know that they're trying to make it easier because it could be confusing, a lot of jargon, you know. But what I also love is that you are also giving us some tips on how to get the most out of our healthcare coverage, right? After February 1st hits, if you're signing up before January 15th, everybody, how can we make sure we're getting the best out of our healthcare coverage? Because we're paying for it, okay?
Absolutely. Health plans now have a list of things that they're required to cover at zero copay.
Zero. It's
Starting,
free.
our favorite number, zero. Starting with your annual checkup and your physical. And moving into things that people need to do as they get a little older, mammograms, pap smears, colonoscopies, all of these things have the potential to derive zero copay from your insurance plan. It just depends on when you have them and how your doctor orders it, but there are a lot of things inside the health plan you can utilize before you start spending money.
Yeah, I was reading that there are also some great, benefits as well, like maybe a reduced amount on your gym membership and all of that. I love that. But last time you were on, you told me about this 3 Ps, and I loved it so much. For people who maybe have missed that, please remind people what the 3 Ps are.
Well, there's hardly anything more confusing in the world than shopping for health insurance, right? Because there's so many options and so much jargon, right? So I always tell people, focus on the 3 Ps when you're shopping. Number 1, provider. whatever doctor or hospital you use on a regular basis, make absolutely sure that your plan covers that before you push the button and sign up for anything. The second P is your prescriptions. Many of us are already on prescription drugs. You ought to be able to find out how much that script is going to cost you in your new insurance when you get it refilled before you pick a plan, and to make sure the drug's covered. And the third is perks, right? A lot of health plans, as you mentioned, have discount programs for things like gym memberships and food delivery, and we want to make sure that you're aware of these things before you select a plan.
So true. And the good news is that if you feel like you're in a special situation, there are people who are available to help answer your questions, right?
Absolutely. Licensed agents all over the state. We're very careful about who we allow to manage programs for us. And when you work with a licensed agent, you're going to find there are people out there who have been doing this for 25, 30 years, and they know the nuances, and they can guide you through and avoid all of the pitfalls of getting it wrong.
Mike, you're helping people out this morning. I want to thank you so much for joining us. And remember, everybody, the deadline to sign up for open enrollment is coming up on Sunday, January 15th. For more information, you can log on to getplanoptions.com or head over to Mike's blog, straighttalkla.com, for more information. You can also follow Blue Cross and Blue Shield of Louisiana on social media at BCBSLA.